Do not pay another medical bill because it's likely that you're getting overcharged. Medical billing errors are extremely common and very expensive for patients, but the problem is that they're very easy to miss. So in this video, I'm going to give you the tea on how to spot errors on your medical bills before you whip out that debit card to pay your provider. Not like I have to pull your arm to put your money away. Nobody likes having to pay medical bills, but here we are. You're watching Finance Tea, where I spill the tea on all things personal finance. A little bit about me. I've been working in the health insurance field for a little over 10 years now. So I know how complicated medical billing codes are. There's so many nuances, and the average person isn't going to really be able to recognize an error. But the problem is that these errors can cost them hundreds, if not thousands of dollars that they don't really owe.
Medical bill coding errors. Experts say they cost us billions of dollars every year. Here's 5 on Your Side investigator Jonathan Walsh with the latest installment of our ongoing series, Diagnosed.
I can describe it as just horror. Horror. I was literally screaming.
It was early July. 75-year-old Maurice Sears from Shaker Heights in pretty bad shape. The hospital billed Maurice's 5-day hospital stay as an observation rather than a regular hospital admission, which would have been covered by his insurance plan. An observation is not.
Part of the problem with coding errors? Well, check it out. There are tens of thousands of these things. Very specific labels that go on and on and on. These papers right here represent just 130 pages out of the nearly 3,000 pages of codes. And that's just one category of codes. Here's another one. And there are even more out there.
$10 billion of overcharges that consumers are charged for in excess of what they should be charged by hospitals.
I'm 5 on Your Side investigator, Jonathan Walsh.
So pretend like I'm your health insurance broker and let me advise you. So the first thing that you need to do in order to recognize an error on your medical bill, you should actually do prior to even getting your procedure done in the first place. When looking for a provider, okay, to handle your medical procedure or anything medical that you need to get done, you need to make sure that that provider is in network. And this is for those with health insurance, of course, okay? So what does in-network mean? In-network basically means that under your health insurance, these providers are contracted with your insurance company for that particular network, okay? So like for instance, if you're with United Healthcare, a lot of United Healthcare plans are under the Choice Plus network. That's a very popular network. It's a nationwide network, okay? So you need to make sure if you're under, United Healthcare, under the Choice Plus network, that the provider that you're trying to, use for your medical procedure is under the Choice Plus network. That's just an example. So with in-network providers, the cost will be subject to your insurance, whatever your insurance plan is. And then you'll be subject to whatever your insurance doesn't cover. Okay, so if you're like on a high deductible health plan, right, and you have a $5,000 deductible and, I guess like an 80% coinsurance after your deductible is met, whatever in-network provider you choose, you're going to have to pay the cost for the services. However, that service will go towards that $5,000 deductible. Okay, and if your procedure is more than $5,000, then you will have that 20% coinsurance, because of course your plan will pay that 80% and you'll pay the 20%. Just another example. If you're on a PPO plan and the procedure is, an actual copay, then you'll pay the copay. So just depends on what your plan is. But if you go out of network, the cost sometimes doubles. And in some cases, it's not even covered at all. So you would be on the hook for 100% of the cost, and not a single dime would go towards your deductible, okay? Because some people have plans where they don't have out-of-network benefits at all. So if you make a mistake and go with somebody who's out of network, then you'll be subject to 100% of that cost, and then not a single dime would go towards your deductible. So make sure they are in network. Most insurance companies have a way to check providers that are in your area to make sure that they're in network. And usually it's online. So like if you're a member with United Healthcare, I always use that as an example because it's a very popular insurance company. But like with United Healthcare, they have myuhc.com, and you can search for providers in your area and that are against your actual network for your particular plan, and then it'll let you know which provider is in network. But you can always call a broker or check with your insurance company, and they'll tell you. They'll likely tell you on the phone. And then of course you can also check with the provider, and they'll let you know as well. Just remember that when dealing with medical billing errors, a good percentage of those errors are due to human mistakes, like human error, which is why you have to advocate for yourself before actually even going to get a procedure done, especially if it's a serious procedure and it's going to be like a specialist type of deal. You really want to make sure that you're checking that out before even getting it done. So the next thing you need to do to detect an error on your medical bill is to make sure that it's an actual bill and not an EOB or an explanation of benefits. EOBs, they simply just show your projected cost and the amount that your insurance will cover. It's not an actual bill. Oftentimes the EOB is actually going to end up being different than your official bill, so don't get mixed up, and please do not pay an EOB when you get it, and make sure that it's an actual bill. The next thing that you can do is if you end up getting a medical bill that's actually higher than you expected, like if it's significantly higher than the EOB that you receive, you can call the provider and make sure that they actually charged your insurance as well. Sometimes they end up, giving you the bill before actually even, charging it to your insurance first. So when your insurance actually pays for it, your bill should definitely go down significantly. It's another reason why you should not pay your medical bills right away. Another thing to do to check for errors on your medical bills is to make sure that your provider fees are reasonable. Federal laws that recently went into effect mandate that all medical providers transparently publish their fees so consumers can check if they're reasonable compared to other local hospital systems. And so there's a free online tool called Fair Health Consumer. It's free, and it shows in-network and out-of-network price estimates for hundreds of medical procedures, treatments, and testing tailored to the person's zip code. This is also a good tool to use if sometimes you have to go out of network. Like, if you're getting a special procedure, a lot of times, especially like if you have a cancer diagnosis, unfortunately, cancer treatments oftentimes are out of network. So this is a really good tool to use to compare costs in your area so that you can go for the most, cost-effective provider. If there is a large amount that you owe and you don't have the money to pay, you could always ask your provider if they can forgive some of the debt. Many hospital systems and doctors have programs to help patients who may not be able to afford their bill. So definitely look into that if you're struggling to pay. If this video was helpful to you, give it a like. And if you want more tea on personal finance, things around paying off bills, paying off debt, just the unfortunate parts of having to deal with adulting in this world and paying bills and, personal finance things, go ahead and subscribe for the tea on all the things personal finance. And be sure to hit that bell to be notified when I drop my next video. Until next time, friends, bye.